Hello everyone, welcome to this session. I'm Christine Jikondiro. Today we are going to talk about typhoid fever, also called salmonellosis. Typhoid fever is contagious disease caused by Salmonella Typhi. Salmonella Typhi is also called a blood bacille. It is also caused by Salmonella paratyphi with different three subtypes A, B, or C. It is a sepsis originated in the intestines. The Salmonella are gram-negative bacilli and they are located in Enterobacteria family. They produce three kinds of antigen, which are antigen O, antigen H, and antigen V. Both antigen O and the antigen H they are reserved for serological diagnosis called serodiagnosis of Widal and Felix. The serodiagnosis of Widal and Felix is positive at 18th day for antigen O and at 12th day for antigen H. The body produces anti-O antibody and the anti-H antibody has a body defense mechanism. These antibodies are detected during Widal and Felix serodiagnostic tests. Anti-O antibody disappear in blood after 2 to 3 months, while anti-H antibody persists for years. Antigen V, which is a variant, is used in vaccination, means it is used to produce a vaccine for typhoid fever. The mode of transmission for typhoid fever, the reservoir of bacteria is the sick or convalescent human and the carrier. The carrier can have germs for months or years in his bile ducts. Then the individual eliminates the germs through feces and urine, and the contamination occurs via the gastrointestinal tract by ingesting food and water contaminated by infected feces or urine from cases and carriers. The role of dirty hands and fries is very important in transmission of typhoid fever. The germs multiply in the lymphoid tissue of the small intestine and in mesenteric lymph node. This leads to mesenteric adenolymphitis. By there, they pass into the lymphatic system and reach the bloodstream where bacteremia and septicemia occur. When we talk about the bacteremia, it means there is bacteria into the blood. While when we talk about septicemia, means the bacteria are into the blood, but they are persisting into the blood. Then they move into kidney and the liver from where they pass out in the urine and feces. Clinical manifestation of typhoid fever. The incubation period for typhoid fever is from 10 up to 15 days, biologically detectable, but it is contagious since on the second day. For the first week, which is invasion period, it is characterized by severe headache, asthenia, vertigo, insomnia, constipation, epistaxis. During this period, the fever increases progressively up to 40 degrees Celsius at the end of the week, while the pulse accelerates slowly, means there is dissociation between pulse and the body temperature. Epistaxis is breathing from the nose. Second week, which is state period, the temperature remains on the top with pulse temperature dissociation. Typhus state. During typhus state, the patient is completely adynamic and interested to everything that surrounds him or her. She also or he's in a frustration, means he has extreme state of physical weakness. There has also delirium, and sometimes the patient can be agitated and aggressive. During that period also there is abnormal movement, means the client can shaking the extremities. During such period the client will have diarrhea and they will have also mild abdominal swelling. They have also loose spots which will occur on the tract within 40% of the patient. They will have also splenomegaly which can occur within 30 up to 50% of the case. There is also light iliac fossa which is gangrene, means there is presence of audible vowel sounds in the right iliac fossa. The client also will have abdominal pain. For the third week, which is the effervescence phase or resolution phase, during this phase, the fever will decrease progressively and other signs disappear progressively. The general state of the client is improved. However, it is during this phase that complication also can occur. For the fourth week of evolution for typhoid fever, which is convalescent phase, it is often long and marked by asthenia. When we talk about asthenia, it is abnormal physical weakness or lack of strength. Complications which can occur in typhoid fever, there are many, and related to two mechanisms. The first mechanism are related to septical complication, means they are due to bacterial dissemination. Here we can find hepatitic abscess, means the client can have abscess into the liver. There is also hepatitis. There is colitis, means the inflammation of gallbladder. There is also purulent meningitis. There is osteomyelitis and arthritis. There is also complications which are due to endotoxin. They are more frequently in which we found intestinal hemorrhage, 2 to 6% of the case. This intestinal hemorrhage is due to ulceration. It is marked by a drop in temperature and a rapid pulse, and also a drop in the blood pressure. The patient may fall in cardiovascular collapses. There is also intestinal perforation which can occur within 2 up to 3% of the case. It is often accompanied by abdominal pain, vomiting, and later there are signs of peritonitis. This perforation occurs often silently and its prognosis is very serious. Myocarditis, which may complicate into cardiac failure, it is characterized by dyspnea, palpitation, precordial pain, and rapid heart rate. There is also neurological complication where we can find encephalopathy with coma. When we talk about encephalopathy, those are the disease that can affect the function of the brain. There is also clinical form of typhoid fever where we have mild or attenuated form of typhoid fever. During this form, the signs are restricted but there is no typhus. There is also severe forms. During this form, there is cholera like diarrhea. The client also will have nervous disorder where they can fall into coma. There is also typhus state, which is present in hemorrhage. This form is often fatal. There is also relapsing forms. They are manifested as attenuated forms of the disease. It is like as they are formed with incomplete treatment, means it occurs specifically to the client who take the treatment but who didn't complete the treatment for typhoid fever. Diagnosis: there is clinical diagnosis and biological diagnosis where they take full blood count and they assume that there is leukopenia with neutropenia. When we talk about leukopenia, it means there is reduction of the total number of the white blood cell into the blood with lower number of abnormal number of neutrophils. They have also to do sensitive diagnosis for isolating the germ. The following exam can be done. They can do hemoculture, which is blood culture, then positive, which is positive during the first and the second week before antibiotic. They can do also coproculture, which is stool culture. Is zero diagnosis of that and the FedEx. It detects the anti-O and anti-H antibody. The treatment for typhoid fever, you have to start with etiological treatment in which you are going to use chlorphenicol, IV, 1 gram 3 times a day for adult person. We can use ciprofloxacin, which is pills, 20 up to 30 milligrams per kg per day, 2 times a day. The duration is between 10 up to 15 days. You can use also ceftazine, which is IV, 10 milligrams per kg per day for children and 1 gram 3 times a day for adult person. You can use also cefotriaxone, which is IV, 100 milligrams per kg per day for children or 2 grams twice a day for adult person. Other treatment, the client must have also or must take corticotherapy. They must also have infusion for rehydration in case of shock or in case of fever persistence above 5 days. The client also must take sedation where we can use phenobarbital in case of prolonged insomnia. We are going also to use symptomatic treatment where we give analgesic for pain and antibiotic for fever. Surgical treatment in case of intestinal perforation also is done. There is also hygieno-dietetic treatment where the client must have bed rest. They must do body hygiene, oral hygiene measures for any contagious patient. For that, it must include easily digestible food, less liquid or semi-liquid food. The following ailment also must be monitored. The healthcare provider must monitor. When I talk about healthcare provider, means the nurses, they have to monitor BP, blood pressure, they have to monitor pulse, they have to monitor temperature, they have to monitor abdominal, they have to do abdominal exam to see if the client has abdominal pain. They have also to assess the state of the stool. Then they have to assess for anemia, which can due to chlorphenicol treatment. Prevention of typhoid fever. Normally, the carriers must not be allowed to work as food handlers. Then provision of food. Good water supply is very important in typhoid prevention. Improvement in hygiene also is very important. As we remember, don't forget the role of dirty hands and the flyers in the transmission of typhoid fever. So it is very important to improve the hygiene in order to prevent the transmission of typhoid fever. Another prevention is vaccination. Then patient isolation and disinfection means the patients who are infected with typhoid fever, they must be isolated in order to avoid the spread of typhoid fever to other people. Then the materials which was used by the patient with typhoid fever, they have to be disinfected in order to prevent the spread of typhoid fever to others. Pay attention, you have to avoid the laxative drugs and to do enema because they may partic- precipitate the intestinal perforation. Avoid oral drugs in case of intestinal hemorrhage and give only liquid food in smaller quantity. Thank you for attending. This is the end of typhoid fever session.